With functional medicine, we're looking at the root cause. What is causing the symptoms, whether it be gut health, skin health, hormonal health? We try to get to the root cause, and you're really going to enjoy today's guest. Today I have with me Dr. Maria Azizian. She is a board certified general surgeon and a certified functional medicine provider. And that's why I'm so excited to have her on the show. She is certified through the Institute for Functional Medicine and is the founder of an online clinic for functional medicine that addresses a variety of health issues, which we will talk about today. Dr. Azizian is also the author of two books, Gallbladder Disease, Easily Explained by a Surgeon, and The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health, something I'm very interested in right now. She provides insights into how identifying trigger foods can transform your skin and influence the gut microbiome, your hormones, and your immune system. Dr. Azizian, welcome to the show.
Thank you so much, Carol. Thank you so much for having me. I'm excited to meet you and sort of almost in person, not in person, but online. So again, thank you for having me. And I agree, this is a sort of fascinating topic. So I'm happy to go into it. So yeah.
I definitely want to dive into our skin health and, why we should be concerned about it and how it's affected by the foods we eat and the habits that we have in place. But I wanted to start a little bit with your backstory. You're originally from Armenia, is that correct?
Yeah, I am original from Armenia. I immigrated many, many years ago. And so I basically have been here since I was a teen. And so I did all my training here, actually, mostly on the East Coast in Massachusetts. I went to undergrad there, and then University of Vermont was my medical school, obviously in Vermont. And in terms of my background of how I came to functional medicine, I went through surgical residency and I work as a surgeon. However, and it's very interesting because I know that probably all of my colleagues feel the same as we treat surgical issues. Well, treatment most of the time is surgery. We see something that is broken, something that is obstructed or dead, because that's when the people come to the surgeon with these types of issues. So, and I always was curious on how to prevent this, because it's not fun to have your gallbladder out. It's not fun to have I do a lot of skin procedures as well. And I do have a skin cancer clinic in Cape Cod, Massachusetts. So like, how does your skin get so diseased and, cancerous or precancerous, which we deal a lot with. So basically, I wanted to kind of, to go to the cause of the problem, be it, GI issue, be it the skin issue. And that's what brought me to functional medicine. So now I have sort of become a hybrid of Western and functional medicine. And I don't call functional medicine alternative. It's not really alternative because it's based on science. It's a scientific specialty. If you call it a specialty, it's completely based on science and research. So, but it's an addition to Western type of thinking where everything has to be fast, immediate, just give the medication or give a cream and it's all done. So functional medicine lets me as a provider and lets the patient to sort of start this journey into the cause, because one cause could have different manifestations. And you can see, for example, manifestations in your skin as a skin rash in one person. In another person, it's the same issue could, for example, leaky gut could turn into, for example, chronic headaches or chronic arthritis or whatever is the whatever is the chronic medical conditions. So it's very, very interesting. And that's how I basically became this hybrid doctor, so to speak.
I love the integrative approach, though, because I always say Western medicine is great. You've been in a car accident or you need that
Mm-hmm.
acute, in the moment care that can save our lives. So I always want to respect that. But then I think combining it with that more integrative, holistic approach where we're looking at the whole body and all of the systems. I think in particular the gut health. When we look at autoimmune, it's my understanding that a lot of autoimmune starts with poor gut health.
You're so right. That's exactly right. Actually, 70% of our immune system starts in the gut. So if the gut is broken, then it can show itself in different places. In some ways, I have to say skin is, well, relatively easy because skin is almost like a visual representation what's going on inside of your gut. That's why with, I would say probably, I don't know, 95%, let's say, of skin problems, we do start with the gut. Not always. We also use food sensitivity testing, hormonal testing we use too, but the base is the gut, because once you start understanding what's going on with the gut, then everything else starts to make sense. There's so many things, starting for example with leaky gut, when the gut cannot defend you the way it was supposed to be. Meaning with the leaky gut, we have, I'm sure I'm sure your audience has heard of it, that there are tight junctions in the gut mucosa. That's the layer of the gut that encounters food, that food goes to. And when we say gut, we're talking about small intestine, stomach, large intestine, our colon. And these tight junctions, they're sort of very small. You can't really see them. That's on the microscopic things. And they protect the integrity of the gut. But when somebody eats, let's say, bad food day in and day out, so it's not like one time, like they're splurging on fast food, processed food, what happens that these tight junctions are getting loose. And now, like all the bad stuff that we used to basically used to come out as waste, now it's being absorbed in our skin. And that sometimes is scary, because when we're young and healthy, our body's still strong. So that's why you can see a lot of young people could get away with that. But even nowadays, I'm sure you all know, your audience know about the spike in colon cancer. So what is it related to in young people? Colon cancer in young people in this last sort of decade or so. And that's very unusual. So what is the cause? And the cause, of course, number one cause, if you take out all the genetic issues and everything else, which are not as significant in that population based on their age, it's what we call at the Institute of Functional Medicine SAD, which is basically a SAD diet. It's a standardized American diet, and it's unfortunate because that's a diet that doesn't do our body any good. So on a basic level, it compromises those tight junctions. So, and because of that compromise, other things start happening. So your balance of good and bad bacteria becomes compromised as well. And then you start having yeast overgrowth, you start candida overgrowth, then you have the overgrowth of bad bacteria. So there's so many imbalances, and it's not a quick fix in most cases. It's not like you can just take a supplement or something and it immediately, because you have to put in the work. And we all have to, because most people do have some components of leaky gut. There are exceptions, but most people who go out to restaurants and, they're not always diligent with what they eat, especially starting a certain age, I would say starting 25, 30, there are components of something being off. It's just sometimes it's symptomatic and sometimes it's totally not symptomatic. So it's asymptomatic and you don't know for years until it manifests. And then people say, why am I having this? Why am I starting to get these headaches? Or why am I I am having hair loss? It could be a variety of manifestation. And that's what makes it difficult, but yet makes it interesting too, to get to the root cause and the corresponding symptom.
Yes, I find the gut health aspect of all this, it can be a little overwhelming because I've had the testing, I've had the GI map, I've been on the supplement regimens, and you're right, it's work. Like to have the testing done, and you have to give it time, and of course, change our diet has to be a part of that too. We can't just take supplements. Where do you recommend that people start if they suspect, you know what? And I'm going to say a lot of Americans, and I'm kind of going to go out on a limb here, maybe the majority have some type of leaky gut or dysbiosis.
Yeah, I agree with you, just based on how we eat, based on the percentage and overwhelming sort of bouquet of this chronic diseases. Dr. Hyman, who's sort of one of my mentors at Institute of Functional Medicine, I don't think he knows me personally, but he's basically teachings and his lectures are one of the biggest components of the training for functional medicine certification. So I do have a lot of admiration and respect for him. So he does have several books talking about that, how it's really, there has to be a commitment to the diet first. That's like number one. But for example, like in my book, where I focus on skin, but I could have focused on other things too. I focus on skin because I happen to have also skin cancer clinic. So I deal with skin a lot. I do see people with eczema, psoriasis, and other non-cancerous things as well. So, but in my book, I show how there's a connection between the diet and between conditions like rosacea, for example, seborrheic dermatitis, which is basically dandruff of the face, acne. There's, of course, eczema, psoriasis. And there are a bunch of rashes that people just come up with that have no names because they often just go away. One of the other problems that are very closely related to the gut is itching of the skin, obviously. And that's a horrible issue because it keeps people up at night and it may lead to, of course, depression, because if you're not sleeping and constantly itching, your whole lifestyle and quality of life is compromised. But in my book, I describe these types of connections, how our food is connected to the to the skin manifestations. Let's say if somebody has some kind of candida yeast in their gut, right? That could easily and often, a very common manifestation of that is dandruff on their scalp, and also this flaky skin that is called seborrheic dermatitis, or dandruff of their face. So when we address the candida in the gut, not only we see that this condition gets better and then goes away, but also we see other aspects of patient's life get better. So I usually start with the gut in most of the cases. Additionally, we also add sometimes food sensitivity testing because that helps to identify the foods that person is sensitive to. And those actually they're not necessarily like bad foods. You would think that it would be something like unhealthy. So no, sometimes it could be like a healthy food, like an orange, for example. Like you may be sensitive to oranges and you're eating oranges every day. And because you are constantly kind of having this assault on your gut, so you're aggravating this leaky gut by eating the foods that are not good for you. And in many cases, I noticed it's so fascinating that foods that we eat habitually, like every day, are the ones that we're sensitive to. Or some of them, of course, not all of them, thank God, but some of them we are sensitive to. So our body develops some type of a sensitivity mechanism. And that's, of course, it's the science behind it. So that sensitivity to certain foods, it's based on immunoglobulins, IgG, mostly IgG immunoglobulins. Food sensitivities are different from food allergies because food allergies, are easy. You know them since you were a child, you identify them, but food sensitivities are almost a mystery. So you have to determine them via elimination diet or via food sensitivity testing. So there are components of gut health that are sometimes could be easy. Like if you identified a certain food sensitivity and you eliminate that and then you get better. So that's very easy. That's a linear thing. But if you have multiple issues, just fixing one issue is not enough. But the short answer, what do we start with not to get overwhelmed? I think that the best way to start, and that's what I do with our patients here, is to start with the gut testing. So that's usually the best thing, because any improvements that you will do, like you mentioned that you had supplements, and any improvements with the gut testing will affect your whole body, and they may take care of the problem that you came with. They may not take care of it, but regardless, they will make you better. Like all of these changes that you make based on gut testing. But I'll stop here, so maybe you have questions. Because that's such a
No, it's very
fascinating
interesting.
topic. I can talk and talk, so I'll
It
let you speak.
is. I was born with severe skin issues. I had
Mhm.
very bad eczema.
Mhm.
I mean, just the worst. Even my brother brought it up the other day of all the things my mother had to do for my skin. She couldn't set me down on grass when I was little. Now, I did outgrow, I guess you
Mhm.
could say, a
Mhm.
lot of it. I don't have near the issues, but I remember how that felt as a kid, not being able to sleep because you just
Mhm.
felt like you were itching or burning everywhere. And it's so interesting to me that I would be, born that way, essentially. Have you seen this in individuals where they're more prone to having, say, eczema?
Of course. And I touch upon that in my book because there are certain things that people are predisposed to, and that's, of course, could be sort of genetic predisposition as well. But most of the time, it's variety of environmental factors that affect that. And that's where personalization comes in, because something that has no effect on one individual can have very bad effects on another individual. And that's, of course, how our so that's the science of epigenetics, how our genes interact with environment. And that's why this classic example of somebody who smokes all their life and then they die of an old age, as opposed to somebody who smoked like for 2 years and then died from lung cancer. Why does it happen? Because of the way our genes are. And that's such a fascinating thing because we really don't know. So why certain factors in you caused eczema and in somebody else, maybe in their childhood, they constantly had, let's say, headaches. Right? Why is that? We really don't know why. So eczema is one of the most common skin conditions. Of course, we see it so frequently, and in some people it's chronic. They always have it like a little bit, and then they have flare up. And there's some people, as you I'm sure know, that it flares up sort of this time of the year, sort of late fall until early spring. So winter, of course, is the worst time for people with eczema, and it flares up, and the dryness contributes to that. And it's so interesting that how our diet correlates, because you one of the sort of the main foods that affect that, and that's what I usually tell patients to do. Like today early, I was seeing a patient who had eczema, and the first thing that dietary, even before we do any gut testing, is to eliminate gluten, sugar, and dairy. Those three things are very, very triggering for the skin. And I say the same thing for acne, actually for most skin conditions. I start with that. If people are motivated, of course, they could be sensitive, for example, to shellfish. They could be sensitive to eggs. There are other things. Ideally, anybody who has a skin condition would benefit from elimination diet or food sensitivity. Sometimes people don't want to do elimination diet, or they're not interested in food sensitivities. Those testings are expensive. So in that case, I think just eliminating three things such as gluten, dairy, and sugar, simple sugars, of course, not complex carbohydrates, but simple sugars like in donuts and things like that. Those simple measures go a long way, because you and looking at the connection between foods and between skin manifestation, it's so amazing how sugar feeds sort of feeds the yeast. Like in general, sugar feeds the
Mm,
yeast, and and it's not necessarily that you will see yeast on your skin or candida on your skin. Some people do, like they wake up with a like oral thrush that doesn't go away during the day. So some people can see that yeast, but gut yeast can manifest in many skin conditions, and that's very underrated in a conventional approach, of course, but it is well discussed. Well, I would say, yeah, it's well discussed in functional medicine, these connections. And in my book, which I divided by foods and by the mechanisms, because there are, for example, dairy triggers not only, it triggers, of course, it triggers insulin because dairy has sugars in it. Just by definition, the galactose and all lactose, they trigger your insulins, and but also they affect your hormones as well. So you start having a complex relationships. Nothing in functional medicine is linear, and sometimes I wish it were. Like we would say, oh, this is
mhm,
causing this, but this adds. So when you stop even these three foods, you stop try to stop it temporarily, let's say for like a month. So you stop them, you will see improvement. You may not completely get rid of your skin issues, whatever it is, like acne, eczema, psoriasis, etc., but you'll definitely see an improvement. And if you don't see it completely go away, then I would recommend going deeper into sort of, you can do the full elimination diet or do a food testing and do a gut testing. All of these things together, they will not make things worse. Let's put it this way. And that's what a lot of times in our clinic, when people, we go through all of these treatments and the supplements and lifestyle changes, because lifestyle changes are very important. Diet and lifestyle changes, meaning like adequate sleep, trying to decrease stress. That's not easy. That's one of the hardest things. Cultivating friendships, good connections. All of these things are part of health. So it's not only about, microbes and sugars and all. It's not only about that. So when people make all these changes, they often come back to me, and when we do like the follow-ups, and they say, like now, not only my skin is better, but I also have so much more energy. Or now I don't have pain, let's say in my shoulder, that I used to have this chronic shoulder pain. So some things that they report to me that they never even told me, during the intake. I'm like, oh, you never told me that. It was part of my life and I forgot to mention that to you. So that's why it doesn't hurt. So we, of course, want, as Western, I'm speaking as a Western doctor, we want complete cure. We always want the complete cure. Is it possible to completely cure a chronic disease that somebody had for many, many decades? That's a question, because at this point, I think that if we make it much, much, much better, that's a good thing. I never promise any cure, because cure for chronic condition, let's say somebody has very bad a lung condition or diabetes, like a chronic condition. So all the efforts that you will be making to make it better, they will pay off. Maybe you may not reach like a complete 100% cure. Let's say you're 85 years old and you've had it for, let's be realistic. But whatever you do will make life better, make the quality of life better. You'll have more energy, you'll feel better, and your condition will get better. It may not go away, because sometimes, honestly, it's just too late. It's just too late to completely, you can't completely, at least at this point, you can't completely reverse it. But with skin rashes, eczema, psoriasis, you can. If somebody is dedicated in terms of their diet, supplements, lifestyle, I see those skin conditions go away actually frequently. Yeah, that's sort of much more optimistic.
You bring up such an important point. I really like that you say you can't say necessarily cure, you can
Mm-hmm,
make things better. I was diagnosed with rheumatoid arthritis when I was 53,
mm-hmm,
and they believe, or my doctor believes, that I was developing it for a long time, that was very slow moving.
mm-hmm.
And so I've never been able to completely reverse that, but I have been able to make it better. I use a combination of the Western treatments with lifestyle habits that I have, my eating habits, my supplementation that I do, that makes it better, but it's never totally gone. And I do have periodically flare ups, especially if I go into a period of stress, whether it be physical or mental stress. I'll notice I'll be more likely, but it is so much better than what it was. And I just really like that you said that, because sometimes we can feel bad if we have a condition and we're hearing, oh, this can be completely reversed, but we're not experiencing that reversal. I know for me, it doesn't feel good. Like, well, I'm doing all of the things right. Why isn't my condition reversing? So I really like that you hit on that.
Yeah, thank you, thank you. I think that it's so important to be honest with the patient, but also with yourself as a doctor, because you need to have realistic goals with the patient, and also then having one big goal is good, but the best thing is to divide it into small goals, and then just be congratulating. The patient should be congratulating themselves for achieving each of these little milestones, because in relationship between the doctor and the patient, especially in functional medicine, it is a relationship of partnership. So patient is doing all the work essentially, and the role of the doctor is to encourage and to guide them with an advice or supplements or testing, interpretation of testing, and all of these things. But patient patient does have the responsibility. And so they congratulate themselves for doing
Mhm.
well. And I always encourage that because it's a lot of work. It's not something, unfortunately, it's not something that could be done very quickly to undo the damage of many years. And in some cases, yes. So yeah, but it is, and I actually like it a lot about functional medicine that patient and I are sort of together in this. We're a team. We're like a true team, and that makes it very. It's sort of like a warm and fuzzy thing. Like we both are in it together on making things better. So it's a this for me, I would say, and probably my patients would say the same, that it's a satisfying journey. It is. There are sometimes, like somebody's trying and then there's a relapse, like they went, let's say, to a party and like, they ate some bad foods and then they have a flare up of psoriasis. Yeah, that does happen. It's life. Sometimes nobody's perfect, right? And it's important not to hold people to such perfectionist standards, because then they will be discouraged even from starting. We're all people and we are allowed occasional sort of, like, especially I know that food has so much social and emotional connection for so many people. So that, yeah, there are situations that's totally understandable. And I think having a support from your doctor or from your team, like you have a nutritionist on your team, whoever you have, like counselor and people like that, like all of these people should be a support, and not somebody who like shames you for a relapse, but somebody who
Right.
supports and understands you.
I agree with that. I just got certified in functional medicine health coaching.
Wonderful.
And it
Congratulations.
is, thank you. It is a partnership to work with people on their goals and to really listen and meet them where they're at. So I agree with you there. Now with skin rashes, I kind of want to circle back around to that because I've had a few clients. I see this a lot, particularly in women, like around the midlife menopausal window where and I know it's gotta be food related, where they're not sure what they're eating, and they'll get, like, an itchy, scaly rash on the face that comes and goes, comes and goes. And do you find that there are I'm trying to word this right. Are there certain foods that manifest in certain types of rashes? So, for instance, dairy, or is it just in general a food sensitivity rash?
So, of course, I don't want to call everything is a food sensitivity rash, although it is very, very common. One thing that I see many patients like that, and in my book, I actually spent one of the first, I think the first chapter of the book, talking about these types of skin manifestations that are subtle. So, for example, like with, I'm gonna kind of go back to discussion between allergies, difference between allergies and sensitivities. When you eat something, let's say you eat like, let's take our orange again. So eat an orange, and even if you have small amount of orange and you have severe reaction to it, you will have a reaction right away, be it that severe hives or shortness of breath or anaphylaxis. Hopefully not, but you have a reaction right away. So and obviously you will stay away from oranges. So now with food sensitivities, you eat the offensive food, but you don't know what it is. So you eat it and you are most likely to have the reaction up to 72 hours after. So that's several days after you ate it. And correlation is very hard to establish. That's why it's so difficult to know. And you asked me whether it's certain foods. Yes, of course, the ones that I mentioned, gluten, sugar, dairy, they're a common culprit. But also they could be anything. I mean, recently we had a patient who actually she was sensitive to tomatoes. And it was interesting because tomatoes, you could have sensitivity. It's not super unusual, but when she was very surprised because she eats lots of tomatoes, and then when she stopped eating them, all of her problems went away. And she still continued dairy, gluten. So that's why everybody is not the same. A personalized sort of medicine is the definition of functional medicine, as you know. So for that patient, these tomatoes were the main trigger for her skin rash. And as she stopped them, she no longer has the rash and she still continues other things. So for her, it's okay. So, and that's why any food, especially if you eat a lot of it, could lead to this body. In some ways, that's a very interesting thing that I see all the time. The foods that we eat the most are the foods that we develop these sensitivities to. But another interesting thing about food sensitivity is the fact that you can actually grow out of it with time. So it's not like a sentence like in this lady's, like she can't ever eat tomatoes. She can try it again, maybe like in 6 months. But another good thing about food sensitivity is that you can tolerate small amounts of it, and small amounts may not have any bad effects. So you may eat a small amount of tomato in the future without any rash. But first, of course, you have to be off. For your immune system needs a few months. First, it needs 21 days for those IgG immunoglobulins to sort of change. But then, honestly, 3 to 6 months is a better time. In terms of the location, any location is a fair game. You can have face. You can have rashes on the face. You can have rashes on the body. You can have vaginal and anal itching. A lot of times we see that in people who have candida on their gut test. They do have a lot of that itching in like vaginal and genital. So honestly, probably any location on the body is a fair game. Yeah.
It's really interesting. Going back to the skin cancers, because you see a lot of skin
Mhm.
cancers. A question that I've had, because I've seen this a couple of times, this is anecdotal, but my stepmother, she passed from melanoma. And I look back at that time when she developed that melanoma. This was a woman who could not stand the sun. She never laid out in the sun. She wasn't out in the sun. If I took her to the store, I had to drop her off right, in front so that
Mhm.
she wasn't walking through the parking lot in the sun. My brother was just diagnosed with squamous. Again, someone else I've been out in the sun far more than him, cycling, running, hiking. He avoids the sun at all costs, but yet he has this skin cancer. What's going on with why people develop skin cancers? Because we know, yes, the UV rays, all of that has an effect, but then what about the immune system, genetics? How does that play into things?
Part of that question is they've always been certain melanoma, for example, melanomas on nails, for example, nail melanomas that are not associated with sun exposure. So that has always been known. That's actually part of sort of classic Western approach. Why is it so? Nobody knows exactly why. For example, for nail melanomas, they're more actually common even in a darker skin individuals as opposed to other melanomas that we see more like in a lighter skin because lighter skin is more sensitive. And with these melanomas, why is that? And one of the theories, which I'm not sure if it's true or not, but it's actually sort of official theory that the injury to the nail, for example, can start this process, which just seems a little strange because most people do have some injuries to the nails. So, but
They
I
do.
believe Bob Marley actually died from melanoma of his toenail. So, and because those are very severe conditions, so severe melanomas that basically there's no rhyme or reason. So you don't know. Like most people do have some injuries to their toenails just from wearing tight shoes, walking, like, so I don't know. But what I think that is the sort of a very interesting area of research, and I actually do a lot of reading myself on that topic, is what turns on the precancerous gene into, to get started, because most of us have precancerous genes in certain areas of cancer, not the same. And there are also genes, and that's another thing we do a lot in our functional clinic is a genetic testing. And I'm sure you've heard of the methylation genes that are responsible for methylation. So those are repair DNA, right? Repair DNA that repairs some environmental assault. So there's something happen. It could be, for example, environmental assault to the body could be severe stress, or it could be an infection, like a viral infection, like a cold. It could be surgery for something different. So all of these are assaults to our poor body. And then something turns on these genes that were dormant. And the genes that are supposed to repair this, to basically not let this happen, are not functioning properly. So that's a very fascinating kind of thing and I think that it's going to be related more with gene therapy, how to prevent turning on these precancerous genes, because you can have even twins with identical genes, let's say precancerous genes that potentially could turn into melanoma or whatever cancer, and in one person, in one twin, you will have that, and the other one who has had different life, you wouldn't have it, and different habits and lifestyle habits. So this activation of precancerous genes into fully blown cancer, so that they're leading to this growth, chaotic and aggressive growth of the cells, which is a cancer by definition. So that's the question: what turns them on? And what turns them on, we know now, like, again, we give these vague things. We say, like, bad food, but when you start breaking it down, so what is a processed food, and you start looking at all of the additives, and each of these additives, if you read up on it, it can cause cancer. So essentially you can have your answer there. So like somebody may be staying away from the sun, but they're not staying away from drinking Coke every day, for example. I'm just saying, right? So, and we don't know what turned on those genes for that person who did everything right by not being in the direct sun.
Mhm.
So having said that, I do have to say that most cancers, we do see tons of cancers in our clinic, are from the sun. You see it on, like, most basal cell cancers and squamous cell cancers are from the sun. That's a majority of cancers. It's the outliers, like you said, not anecdotal, because there's still a percentage of people. It's the outliers who have it not from the sun, but most people still have control over that with, again, my, as I call it, sunscreen propaganda. But I do feel I do it myself every single day. In the winter, in a snowstorm, we do recommend sunscreen to the face. And of course, in the summer, or if you live in hot climate, then it should be whatever is exposed, in addition to the face, of course. But you're wearing shorts, then the lower legs, and etc. So, but yeah, so I think that since most people still have cancer from the sun, so I would recommend that they do the right thing with that, and eating healthy, avoiding toxins. And toxins could be also, we didn't talk about it, but like makeup. Like, makeup is like, has so many, and I love makeup myself, and of course it's hard, but yeah, makeup does have toxins in it. So there's like all these things that we don't know.
Yes, as women, we're putting
Yeah,
so many products on our face, and I get frustrated because some of the non-toxic type cosmetics, they don't work very well.
true,
So then
true.
I'll
I
catch
agree with you.
I'll catch
I agree. Yeah.
what I try to do is something kind of, I guess, cleanish. There's a book called Cleanish. I forget the author. And basically, she's saying, you avoid as much as you can, but then there's always going to be those times where it gets into because the toxins are everywhere. I mean, it's in our air, it's in carpet, it's in draperies, it's in dry cleaning, and it just can be so overwhelming to start to try to eliminate these. I know a couple years ago I went on a plastic thing. Okay, we're getting rid of the plastic
Yeah.
in the house. Oh my goodness, I felt like plastic was everywhere in my house.
Yeah, yeah. I actually, on my YouTube channel, I have a video about that. And of course, I'm glad you sort of brought it up, because, for example, with plastic or with anything, honestly, you can go so far and you can become paranoid about every little thing.
Yes.
And life becomes then hard, because now you are creating a lot of stress, in addition to the stress from those toxins. So I think that the key is to be somewhere in the middle, and we all fluctuate. Like you said, sometimes we are on this crusade to get rid of whatever, and then sometimes we say whatever, I'll just use it. So I think that being somewhere in the middle is very helpful, and making small changes. For example, if you use plastic, like, you can use plastic to, like, store something in there, but don't put the plastic container in the microwave, because then you're basically going to eat plastic with your food. Don't put that plastic in a dishwasher, same thing, because it's like seeping all these carcinogens, essentially. So, like, somewhere in the middle. So you may use plastic maybe to store, like, to store some foods, like dry foods. That's much better. I'm sure it's probably not 100% healthy either, but it's much healthier than, let's say, I did some, like, heated microwavable food in a plastic, like things like that. So just making these more common sense measures. Otherwise, I do have some patients who like suffering from trying to basically be completely clean, and that's wonderful. That's a great goal, but sometimes it could be all consuming. So being somewhere in a spectrum of a common sense, I think, is the best way not to lose your mind.
With you, and I've kind of learned the hard way being in the fitness and health coaching to, not do fear mongering. And I've really had to take a step
Yeah.
back where, okay, I want to share information and make people aware. But then at a certain point, I realized some of my clients, like I was stressing them out
Yes,
by it was
exactly.
too
Yeah.
much, way too much. And then you're right, that's not healthy either. If your cortisol is elevated and you're in
Hmm.
chronic stress trying to avoid plastic, obviously that's not ideal either.
Yeah, yeah. So it's just hopefully, I think that as hopefully things will change on a more global level. So we're just less exposed to it. Like, the use of pesticides, the use of all of these, and these types of global changes almost at the level of government, that those are very important, because it should not be just consumers a job just to look at every little thing. Most consumers are not that educated. Just because it's not our job, we can't know what's in every product. So I think that better vetting of the foods and other products that touch us in any way, it could be even through inhalation or touching our skin, like clothing or makeup or creams, like all of this just in general has to be better regulated.
Yes, I agree. And it's hard too because as a consumer, like you said, it's really not we're not trained to
Hmm.
look at these labels and break it all down. We can, and I do encourage my
Hmm.
clients, look at labels, read
Yeah.
labels, find out what you're putting into your body. But then there's all these little tricks, especially in the food industry, they'll play where they can still kind of slip these things and we don't know. We think we're doing something good and we're not.
Like one of the trick I always share with my patients, I'm happy to share with you and your audience, is the moisturizing cream that have sunscreen, or any kind of makeup that has sunscreen in it. The sunscreen is very little. It does nothing. It literally does nothing. So sometimes patients say, oh yeah, I use sunscreen. It's in my makeup or it's in my moisturizer. And that doesn't count as usage of sunscreen. It's a very small amount, and it allows the manufacturer to increase the price of the product, and it has no value. So I always tell patients, please use like clean regular sunscreen. And then you can use whatever cream you're using, not for the sunscreen, whatever the purpose it was, like moisturizing, but any addition of sunscreen. I mean, I'm sure there are exceptions, but so far I haven't seen any, that this sunscreen is just to elevate the price. Because people say, oh, it's sunscreen, how easy. So then I don't have to put, like the real sunscreen on because my cream has sunscreen. So, and it's totally useless. So yeah, so I do recommend, of course, the best sunscreen is organic sunscreen or mineral sunscreen. Baby sunscreen also could be used like in place of organic or mineral, because it only has two ingredients. But aside from the conversation of sunscreen, those added sunscreens, they are essentially for the most part useless, unfortunately.
That's a good tip because I have, as you were talking, I was thinking about this. I have a product and it's a tinted sunscreen. So it's almost like a cross between makeup and
No,
sunscreen.
tinted sunscreen, if it's only sunscreen, then it is sunscreen. It has tinted,
Oh, okay.
but if
Yeah, it just
like
has a tint.
yeah, no, that is a sunscreen. But if it's like moisturizer and says like with SPF, I mean, that's fine, that's great, but it doesn't take a place of sunscreen. So you can, or whoever continues to use that, that's totally fine. I think I have some products that have that, but they are not the source of my sunscreen. They just happen to be, I like the product that puts the sunscreen. Okay.
Now, what about our immune system? How does our immune system play into skin diseases, skin issues, skin problems, and what can we do to support our immune system?
So coming back to the gut, we always come back to the gut
It
because
always comes
because
back
yeah,
to the gut.
exactly, because our immune system essentially is as good as our gut is healthy. Basically, the health of our gut would dictate the health of our immune system. For the most part, of course, you could have separate issues with your immune system, for example, like a spleen problem, like for example, but those are rarer or more obscure kind of problems. So we're looking at like a regular person, let's say average, more or less healthy-ish person who periodically has issues with the skin or whatever, like flare-ups of something like joint pain or something like that, or GI issues are very common, like IBS, etc. So with these types of people, the gut immunity and gut microbiome and leaky gut, all of this sort of blends one into another because the immunity is propagated through immunoglobulins. There are different types of immunoglobulins, and they're all connected to the gut. And I'm sure you've seen recent research on connection between Parkinson's disease and Alzheimer's with the leaky gut. So, and honestly, like as time goes on, like, and I do a lot of research for my own interest. I love medicine in general, and for my channel, my YouTube channel, because I always look for new, and I think soon there won't be any medical condition that won't be tied with the gut, starting with immune conditions and ending with conditions like neurodegenerative conditions like Alzheimer's. So if you are addressing your gut, you're doing a lot of work already for your immune condition, whatever it could be rheumatoid arthritis, could be lupus, and there are different mechanisms. And in my book, I look at the immune, and that honestly was the hardest chapter for me to write because I thought that I tried not to make it boring because some of the immune concepts like cytokines and leukotrienes, like all of these messengers of immune system are they that's how immune system works. Like one of the I think the example that I tried to make in the book that basically when you look at those messengers like cytokines, it's like you have these, let's say somebody like delivers food in a big and busy city. So these messengers, they're actually like food delivery. Like that's like a, I'm trying to make it more kind of relatable because it's a very dry concept. So like, do you have this delivery people on their bikes and everything is working well? They deliver, from a restaurant, they go like, Uber Eats or, something like that. But so those are normal functioning cytokines. But then something happens and their like system of communication is broken. Now you have these people going to different places, delivering to the wrong people, picking up wrong orders. And that's what happens when these cytokines go awry, when they stopped working well. So that now you can have variety of symptoms. And sometimes I have young people like, like 20, 30, early 30s, and they have tons of symptoms. They have a runny nose and they have a headache, they have itchiness, they have blurry vision. So we have this MSQ questionnaire where we ask the medical symptoms pertaining to each body system, and they get high score for each of this system. And you may have somebody who is like I said, young person, and score very high because of all of these events going on in their body, and so many things are out of order. So there's definitely an immune component to it because again, like these food delivery people, it's a chaos. So all orders are messed up. They go to different locations or different people, or there have been no orders and the restaurant is not ready. And that's how, with when you talk about IL-6, IL-2, like TNF alpha, like all of these, interleukins, and they play a big role in being the messengers. But it all starts again from gut is one of the biggest areas that controls that. Not only, but hormonal is very important, and other systems like structural and your muscles and everything else, your genetic, epigenetics. So all of this plays a role, but immune system always starts with the gut. That's an easy one, I would say. Yeah.
I agree with you. Even looking back on my rheumatoid arthritis, the decade prior to that, I was having major digestive issues and was diagnosed with IBS, which is kind of almost like a bucket that it's like, we don't know what's wrong with you. So there you go. This is what you got. And I look back and realize my diet. I was
Mm-hmm.
eating a lot of processed foods, ultra processed foods, really,
Mm-hmm.
and not enough protein, clean protein. I had some habits that played into that, and that's really where I think my autoimmune started developing when I look back on that. And then you look at the role, now they're uncovering the role of trauma and
Mm-hmm.
you get this kind of perfect storm where somebody has past trauma, they have the gut issues, maybe there's a family history on top of all that of autoimmune, and it's like a perfect storm brewing.
Yeah, and you described actually it's a very I call it like a little sort of it's a hint for me. So when a patient comes in with a skin problem or unrelated issue, let's say joint pain or some chronic pain someplace or something not related to the gut, and then we start talking about their GI and they say that I have IBS. That's like a little hint. It's almost like a blessing because it for me in a sense of to establish, because I spend a lot of times on creating the treatment plan. That's the most interesting but the most tedious sort of component of, like, especially in the beginning, because I want to create a treatment plan that takes in their regular medications. I try not to make any changes with the regular medications like pharmaceuticals in the beginning especially, and to add herbals, to add supplements, to add everything that works with their other health problems, does not have any reactions with what they're already taking, and will not cause any possible side effects that would be detrimental. So all of these, so having the gut issue is so helpful for me because now I understand it's almost like a hint that start there. So I focus on there and then I keep going. It's not always, I don't always start with the gut, but when somebody is coming with like autoimmune issue and they have or had gut issue, it's like a hint for me, like a little, like I'm happy to hear that. So I always ask that just makes it a little bit easier for me because it's very important to create a treatment plan. And again, aside from the supplements and also there's a lifestyle part of the diet that's all part of the treatment plan. So, but it just makes it more, I think, that palatable. And I can say always, actually, I can say that people do have improvement in their GI function, even though we're like focusing on their other symptom, but their GI function gets better with good foods and all this supplements. And what are supplements? Of course, probiotics are very important ones. Now the probiotic industry blossomed. We actually have now probiotics for cognitive function. There's special blend for cognitive function. So
Yeah.
that's so interesting. There are all kinds of, so choosing probiotics very important. Prebiotics, which is a food for probiotics, and there are all these other supplements that are personalized. So each person gets something different. There are some common themes, of course, but it depends on who they are, what they're taking, who they are as a person, what they are willing to take, how many supplements. I try not to overwhelm people with supplements, but yet some people need more than others. But yeah, that's just a fascinating kind of world of all of these um, sort of changes that are not that difficult. They're not as difficult as surgery for a patient, but they're just long term and they require you to be always accountable for your own actions.
You probably have to be a bit of a detective uncovering, the root cause of what's causing somebody's symptoms and why they're suffering with, say, skin rashes or gut issues. And I imagine that, yeah, you really have to peel back the layers and once again be a bit of a detective there to figure out what is what.
It's exactly, and that's very exciting and sometimes frustrating part. Recently, actually, we've had like several patients in our clinic who actually was kind of easy because they had significant, not minor, parasite infection that got picked up by a gut test. So that makes it easy for me. Like, although there are other things that test shows that we're working on, but I know that once we address this parasite infection, they will definitely be better in every way. Maybe not like some 900% better, but what was the problem for them would get better because those are very satisfying moments. But in many cases, it's not like that. It's, oh, this is a little abnormal and this is a little abnormal and that. So, but which one is the actual cause? Is it the combination of abnormal findings or is it just one thing? So yeah, it's kind of almost impossible to know, especially in the beginning. But as time goes by and I work more with the patient and we make changes, it actually becomes easier. But it's very interesting. It's very intellectually stimulating. That's why I love
I bet. And I do love your approach of, not throwing Western medicine under the bus
Yeah.
and really saying, okay, I'm not going to pull you off of your medications, but let's see what we can do with lifestyle, maybe supplementation, testing. And I really do love that approach. Doctor, as we begin to wrap up, was there anything I didn't ask you that you'd like the listener to know? And how can they get your book, follow your work, learn more about you?
Well, thank you so much. First, I really enjoyed our conversation. So, no,
I
I
did too.
enjoyed your questions. I think that they were all great. Honestly, these are the topics that we should all be into it. Not only like professionals like me, but I think that as we all learn, starting with children, that why is it not good to eat like, chicken nuggets that they give you at school, during school lunches. So that, those are like, why is it bad for you, right? So children need to understand. So we all, and as a society, I think that we're all getting better at that. So slowly, slowly, again, not everybody needs to be fully into functional medicine, all of this, but if people know, for example, this is not a good food, it's not prepared correctly. It's this food basically is a dead food. So right in this ultra processed food, this is like not, it's not eating like a super processed apple pie from a supermarket is not the same as, first of all, it's not the same as making that pie yourself. And it's not the same as just eating an apple, right? There's three different things. I'm not against apple pie. I love apple pie, but it's always better to make it yourself with ingredients that you know and you can choose, rather than if you read the list of ingredients and what you buy at the supermarket. There are all chemistry labs there. So yeah, so I appreciate your questions and I appreciate your audience's interest in these topics. In terms of my book is available on Amazon. And what else can I say? It's called The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health. And basically goes into a variety of foods and the mechanisms and reactions, and goes into a variety of skin conditions. But it's not only about skin, it's about, you can't just write about skin because it affects the whole body. So it goes into other things. So, and I also welcome everybody to check out my YouTube channel, which I love because I love medicine a lot. So honestly, it's kind of like a creative outlet for me. It's called Dr. Maria Azizian.
Dr. Azizian, thank you so much for being on the podcast. I encourage the listeners, get the book and check out her YouTube channel. I was going through it in preparation for this podcast and was so impressed. The information is laid out very, very clearly. The subjects, very easy to understand, consume. You'll take something away that you can apply. So do check out that YouTube channel. And thank you again, Dr. Azizian. I appreciate you being on the show.
Thank you very much, Carol, and have a nice day and happy holidays.
Thank you. And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.
Oh, thank you so much.